Hey, everybody. This is Devin from the Christ Light and Love Center here in the middle of the Burkesville, Kentucky vortex. And today, guys, we are blessed, we are honored, and I'm sorry, everybody. We have Jerry Marzinsky here today with us from Engineering Mental and Spiritual Sanity. Jerry, I bow to no man, sir, but I am going to tip my hat to you because you are a man in the arena. You were in the psych field, what, 20 years before I think I was in the psych field. Now I wanted to have Jerry on the show first. I wanted to book this guy 2 years ago before I had a podcast, because what he is saying lines up basically 99.9% of exactly what I was experiencing in the psych field when I was there. So we're going to be talking, of course, about the archons, about demons, about attachments, and how this really plays into this field of mental health. And Jerry, I'm going to quit rambling over here. I'm going to let you take it away, brother. Again, thank you for being here.
You're welcome. I guess I had to put a little bit in there about my background.
Absolutely.
I'm a retired licensed psychotherapist. I mean, this is the state license that I dropped on purpose because I felt they would go after me for telling the truth. So I dropped it a good while ago. I'm now a certified mace therapist, which is the only therapy I've seen in 45 years that actually works. And you can see the results, and you can see them quickly and accurately. It actually gets rid of psychological traumas. I mean, it does it quick, does it without drugs. So I spent close to 40 years picking through the head of psychotic, criminally insane patients. Started off working at one of the biggest psychiatric hospitals on the planet. Like I was telling Devin, there were about 10,000 patients there when I got there. It's the size of a small city. Went from there and went back to graduate school in the PhD program and virtually saw how worthless it actually was. I mean, it was like a brainwashing thing to make you think like they thought, and how they thought wasn't curing or helping anything. I mean, you take what they're teaching, you put it on the front lines, and it doesn't work.
Yep.
And it never had. So spent 2 years there, and then came back and got a job in the psychology department of a large state prison. Okay. Now, while I was in the state hospital, I saw some things that didn't fit in with what I was being taught in school. Okay. And one of the first things was that, schizophrenia and mental illness was a chemical imbalance of the brain. Okay. So you think if there was a chemical imbalance of the brain, that they would have some kind of test to find out what was out of balance or by how much.
You sure would think that, huh?
You sure would think that. But after a couple of years at the state hospital, I never, ever saw any psychiatrist give any kind of test to determine what chemicals in the brain were out of balance or by how much. So I'm like, what's going on there? They don't have a baseline. How do they, if their drugs are balancing something in the brain, how do they know what they're balancing, and how do they know which ones to give, because they don't know what's out of balance? So I don't know, what are there, 23 different neurotransmitters in the brain or something like that? They didn't. I found out they didn't even know what the balance of the chemicals in the brain should be,
Well,
let alone balancing anything.
And Jerry, just looking at serotonin alone, I mean, science now is saying, well, very, very small portion is even made in the brain, even if it has something to do with depression. They're saying the majority of it's made in the gut. So how are you going to correct an imbalance that's not in the brain? But if you're going to say there's an imbalance, well, it's an imbalance in the gut, probably.
Well, where this came from, that whole chemical imbalance garbage, is propaganda.
Yep.
It's a total lie that was put out by Eli Lilly in 1991. So I got a short article here. It said it was not until the late 1980s, after the release of the landmark antidepressant Prozac, that the idea of the chemical imbalance hit the psychiatric mainstream. As psychiatrist Peter Brigham, 1991, points out in his book Toxic Psychiatry, you want the truth about psychiatry, read that book. He comes out with it. He just exposes the lies, the deception, the scams, I mean,
What
it's
is
such
his
a
name again?
corrupt.
What is his name again?
Peter Brigham, Breggin, and he
I
wrote the
wonder.
book Toxic Psychiatry. He exposes the truth of what these people really are and how they operate.
Right.
You know, and he was one of them. He was high up in their organization. So he exposed in his book that Eli Lilly drug company came up with the chemical imbalance theory as a marketing scheme to sell their new drug Prozac. There was no demonstrable evidence showing that depressed patients had any imbalance, but Eli Lilly put it out anyway. A total lie, a total misconception. Before long, psychiatrists and psychologists and patients came to identify with the idea that mental disorders are caused by chemical imbalances in the brain. Then the drug companies took it over and went with it. And they started advertising it. Our drugs, you know, cure this chemical imbalance of the brain or set it right. Now, who's going to disprove that? You know, the average psychologist, the average psychiatrist, the average doctor, the average researcher, who's going to disprove that? So they kick it up out of the purview of the common man and most of the population. They kick it up to where the biochemists have to prove it or disprove it. And of course, most biochemists aren't going to be interested in, you know, studying chemical imbalances in the brain. So they got away with this for decades. It was a complete lie. They're still advertising it. You can still pull up, you know, these advertisements, only they say, oh, it is believed that, you know, that there's chemical imbalance in the brain.
Well, you know, they still preach it, but the sad thing is it's just been disproven probably 100 times over all over the world.
Yeah, it has. Matter of fact, here's an article on molecular psychiatry. It says our comprehensive review of major strands of research on serotonin shows there is no convincing evidence that depression is associated with or caused by lower serotonin concentrations or activity. So this is what the drug companies were saying. Oh, it's got to do with serotonin. So we give the patient serotonin reuptake blockers, so there's more serotonin to activate their nerves. It's a crock of crap. They're lying just to sell drugs. You know?
Now, wait a minute, though. How about that side effect profile on Prozac, Jerry? How's that look?
It looks awful.
Yeah.
You
And,
know, I think they had to put a suicide warning out on that stuff.
well, I had a patient, right, and normal functioning. I don't even know why he went in, decided to, you know, to ask for a little bit of, you know, antidepressant. I think he probably went in to a psychiatrist and they, you know, just said, here, try this. But what he told me, for a little, you know, average Monday blues type depression, they put him on some Prozac. He said he was only on it 2 days. He said the first night he felt really strange. He said the second night he had dreams the devil came to him, told him to kill his family and himself. He said he recognized it, that it was somehow tied to that Prozac drug, and he said never again.
Yeah, and that happens to a lot of people. You know, there's 50,000 people kill themselves in the United States every single year, year after year after year, and most of them are on antidepressant drugs.
Yeah.
Okay, so here they are. They're fostering these lies, and they said most studies found no evidence of reduced serotonin activity in people with depression compared to people without, and the methods to reduce serotonin availability using tryptophan depletion do not consistently lower the mood in high volumes. High quality, well-powered genetic studies effectively exclude an association between genotypes related to serotonin and depression. So it's a friggin' lie. You know, that's the first lie they put out. Okay. You know, and there's not a single peer-reviewed article that can be accurately cited to directly support claims that serotonin deficiency in any disorder. And there's a lot of articles that say the opposite. Okay, so it's a friggin' lie. To Ronald Pies, here's another psychiatrist. He said the demise of the chemical imbalance theory in view of the mounting evidence against it, after more than 20 years of being told that a chemical imbalance in the brain causes mental illness, such as anxiety disorder, depression, the theory was finally put to rest when Ronald Pies, the editor-in-chief emeritus of the Psychiatric Times, stated in the July 11th, 2011 issue of the Psychiatric Times, said, "I don't believe I've ever heard a knowledgeable, well-trained psychiatrist make such a preposterous claim that mental patients have a chemical imbalance, except to mock it." Okay? So this is what they're still teaching in the universities, because the universities are controlled by big pharma. Okay? They foster what can be printed, what can't be printed, who they'll support. They tell the university, you print this stuff that goes against our drugs, your stipends are done, your grants are done. We're not going to support you. So they're still teaching this in the universities, even though it's a lie, and they're fostering it on the population. The entire population believes that mental illness is due to some biochemical imbalance, which is total made up garbage. Okay.
So now you seem to be, I did not know you when I worked in the field, right? I didn't know any of your work. Of course, the internet was really just kind of a young thing back when I was in the field. But so, I was always looking, I came to the same conclusion. This isn't a chemical imbalance, but I always wanted to look for, answers. Well, what is it? What is going on? The common theme, Jerry, that I kept running into is it seemed to be more like, what was out of, what I learned in my Bible, that it was something else going on. So
there's something else going on. All right. Here's the market value of what they're doing. The antidepressant drug market in the United States is expected to reach 15.98 billion by 2023. 15.98 billion. We're not talking about million. We're talking about billion. And that's just in the United States alone, not worldwide. Worldwide, it's probably hundreds of billions. Global antipsychotic sales. Now, these drugs cure nothing. All they do is dumb down the person. They turn them into a marshmallow. It's set to hit 14.54 billion in 2021 and expected to reach 15.5 billion by 2022. That's what's going on. These people don't want a cure for depression. They don't want a cure. They don't make any money from cures. They make money from sickness. So all this crap that they're doing is to convince you that you're mentally ill. Look at this DSM thing that they have. I mean, every single one of those diagnoses were fabricated. There's not a single diagnostic test to show for any of those. A valid diagnostic test.
Well, and that's what I was finding, Jerry. Just my my short stay in it. When you really started to look at the DSM, you could apply a lot of the different characteristics out of any and all of the different diagnoses to anyone if you really wanted to. It was, and you could never. The other thing that I kept seeing, and I would say to my patients is, sure, or I'll say to my friends today, go get your diagnosis from your psychiatrist. But I said, if the diagnosis was something real, it would be like when you break your leg. You go to one doctor, they go, oh, you broke your leg. Here, we're going to mend you. You go, oh, I want a second opinion, right? Well, you go to the other one, oh, you broke your leg, we're going to mend it. You go to the third one, and he might be out to lunch that day and somehow misses that your leg's broken. But if you go back, he's going to go, oh, no, it's your leg. But that's not the case with psychiatry. You can go to 3 different psychiatrists and get 3 different flavors of your diagnosis.
Right. And if you put 10 of them in the same room and you give them the symptoms, they're going to come up with, 8 or 9 different diagnoses. It's not going to be, it's totally subjective. They need it for the insurance. They need to have to put down something for the insurance. There's not a single valid objective test to validate any one of the almost 300 diagnoses that they now have in the DSM-5. So they make these things up. They just literally make them up. They have a range of human behavior, and they chop it up and they pathologize it and give it a label. You gotta admit their DSM looks. I mean, it's impressive.
Oh yeah,
You know, it's
it
got,
looks all fancy.
it looks fancy. I mean, it looks like scientific work. Here's all these numbers and categories and subcategories and subcategories and subcategories and these broken down, and it's like bewildering. It's like, wow, look at this. I mean, it looks like a real work of science. It's garbage. You know, in 1952, the DSM listed 106 psychiatric disorders. By 1980, it contained 256 psychiatric disorders. The DSM-5 now has 297 psychiatric disorders. You know, so they're making these things up as they go along.
Well, it also seems that they like to keep in touch with the current social programming that's go along, because at one point in time certain things that were diagnoses are not anymore. I don't even know if gender dysphoria is even considered a diagnosis anymore. Isn't it probably just a normal thing?
Well, I don't know. They make them up. I mean, they make them up. They vote them in and they vote them out. Well, two-thirds of the psychiatrists on that board responsible for making up these diagnoses are deeply associated with big pharma.
Yeah.
So you can tell what's going on. I mean, it's I've heard it takes on the trappings of a tobacco auction. Where somebody comes in and goes, "Hey, I got a new diagnosis, and it's and these are the symptoms," and they sit there, and of course, the whatever they do in there, it's tightly secreted. They don't have notes. They don't have releases. There is no, what do you call it, visibility. You can't see what they're doing in there. It's like in secret. There's no they don't put anything out. They don't want anybody in there. It's just them. Okay. But there's no blood tests. There's no lab tests. There's no x-rays. These are just classes of behaviors that a group of psychiatrists have voted to be a mental disorder.
The other thing to that, Jerry, is, a lot of my own patients, I was a behavioral therapist. That's all I did is I monitored and counted behaviors. I understood to a great deal who my patients were. They go to psychiatrists, get some new diagnosis they never had before, and I'll be damned if time and time and time again they didn't become that diagnosis to start to display pieces of what that psychiatrist told them they were. It was almost like, it's like voodoo.
Yeah, I wouldn't be the least bit surprised. And then 25% of college students in America have received some kind of mental disorder diagnosis. The National Alliance of Mental Health reported approximately 1 in 5 adults in the U.S., 43.8 million, experience some kind of symptoms based on the DSM, which is totally fabricated. And some of the diagnoses they have in there right now are mathematics disorder. You don't like math, you're disordered. I'm one of the major ones. I hate math.
I heard rumor, I didn't check it out for myself, but I heard there's one that your doctor can give you if you refuse a prescription he might suggest to you. I heard there's a diagnosis for that.
So they got all the bases covered.
I mean, it's nothing but a control mechanism. That's all it is.
Well, it's worse than that. They got mathematics disorder. They got sibling relational disorder. So a couple of kids are fighting in the family. Now they're disordered. It's a disorder. Okay.
And people embrace these disorders. I'm telling you, they'll wear it like a badge of honor. Like, this is who I am. It's like, you're not a bullshit diagnosis.
Yeah. I heard they had Southern Bell syndrome in there for a while.
Southern Bell. What's that?
Southern Bell syndrome. Oh, that's like Charlotte O'Hara and Gone with the Wind.
Oh, you gotta be kidding me.
That's what I heard. Now I know they have they call it the Paris syndrome or Paris disorder. It affects Japanese visiting Paris who wig out because of the beauty of Paris. And basically, it would have been called cultural shock, years ago. Now it's a disorder, and it's to be treated with antidepressants. That's what they recommend.
That seems well, but if that doesn't work out, you can always add a little antipsychotic on top of your antidepressant, right?
Oh yeah, they just keep mixing them. Doesn't matter. They just keep them coming. So you got the chemical imbalance lie.
Yeah.
You got this DSM lie that they fabricated. Complete deceptions. Okay. Then you have this brainwashing that they put the world through, that the only way to treat mental disorders is with chemicals, with drugs. They don't work. They don't work. They don't cure anything. They might suppress symptoms, but they don't cure anything. Right. So let's look at the report card of the current mental health system, the Western mental health system. Okay. It's estimated that there are 24 million schizophrenics worldwide, 3 million in the US, all being drugged. Okay. The CDC reports that 132 people in the US kill themselves every single day. Okay. Suicide's the 11th leading cause of death in the US. In 2021, 48,000 Americans killed themselves. Last year, it was 50,000 or more. And this is year after year after year after year. There's more psychologists, there's more psychiatrists, there's more psychiatric meds on the planet now than there has ever been in the history of mankind. And look at the results we're getting with this deceptive, duplistic, psychiatric managed, pharma-backed mental health system. Okay? Between 2000 and 2018, suicide rates increased 37%. So things aren't getting any better. They're graduating more psychiatrists, more psychologists. They're producing these drugs by the truckload, and everything's getting better. It's the worst. It's getting worse. 10,000 Americans are diagnosed with schizophrenia yearly. It's the top 10 leading health problems on the planet. Okay. According to the Center for Disease Control, the suicide rates have reached the highest level since World War II. Now, does this look like an effective mental health system? Does this look like it's working? It's a scam. The whole thing is a scam, and they're just after the money. And if you look at what they're doing with research, they have reduced the amount of research into schizophrenia and mental illness down to a dribble. They've manipulated the statistics to make it look like it's more than what it actually is. But they have no interest in finding a cure for any mental illness. They're making too much money. Yeah. They don't want a cure. They want to suppress symptoms. They want you buying their medications to suppress those symptoms. So look what they're doing here. Over 622,000 kids are on psychiatric drugs. As of 2017, over 1 million children in the U.S. under the age of 6 were on psychiatric drugs. Okay.
Hey, Jerry, what does an ADHD drug do to the young mind of a male? So let's say somebody's considering putting one of their son on an ADHD drug. They're 7 years old. What's that look like as they grow up?
You know what? As of a couple of years ago, I asked some psychiatrists that. They said they don't have that information. But there is information coming out that it does negatively affect your heart. Now, what I've seen on the front lines working in the prisons is that kids would be prescribed Adderall and Ritalin, which are basically amphetamines.
Yeah.
And even though they were working for them and they calmed them down, they helped them concentrate, they kept pushing it and pushing it, taking more and more and more until they went out on the streets and they started using meth. Now, meth is a totally different ballpark. Meth lets these voices, these demons in like no other drug I've ever seen.
It opens a portal straight to hell.
It does. It opens a portal straight to hell. The prisoners even called it the devil's drug.
Yep.
I've seen more prisoners go psychotic on amphetamine than any other drug out there. And it starts out where they start hearing these same voices that a schizophrenic hears, the same negative voices. So you're no good, you're rotten, you're stupid, you're ugly, nobody likes you. That same rotten stuff. And they go, well, it's just a hallucination. When I come down, it'll go away. And it does. And it may happen, 5 times, 20 times, 25, 30, 40 times. And then one day it doesn't. And they're stuck with those voices for the rest of their lives. They're just as crazy as anybody locked up in a psychiatric hospital. So it's a very dangerous drug.
I didn't really even kind of consider it from that take, but it's almost, in many ways, it's a gateway drug to, hard methamphetamines. And I've heard many people, I guess, think about that now. I've heard several people who are meth addicts say that, no, I was introduced through my ADHD drugs. They just didn't work anymore, so I wanted something stronger. I grew up with a kid who parents put him on, ADHD drugs. I don't know, maybe he was 7. I mean, to me, he was just a normal kid, maybe a little bit odder than I was, but, we're all a little bit odd. But, he stayed on those, I think, through till he was 18 or 19. Still to this day, he doesn't do any other drugs, might drink once in a while, but he is not a normal human being. He is not able to function, communicate in the way that I think you should normally be able to, at least. He seems stunted. Now, this is what I used to do, Jerry. Whenever I had a parent come to me and they were worried about, ADHD drugs, or if the school was pushing them and then the doctor was pushing them, I'd tell them, just go to the doctor. I'd go in there with them and I'd say, doctor, would you please explain to my parent here brain apathy and ADHD drugs? And normally what I got was this. Shut the book. And they'd say, no, we don't absolutely have to prescribe that. We can do something else. Because they knew that, no, it doesn't matter, that, that particularly in my brain, in my mind, it was the male frontal cortex is not fully formed sometimes until we're 24 or 25. I mean, that's why we make really dumb decisions, in comparison, the same counterpart age in a female. But no, that's one thing that I found. It would shut down these doctors really quick and shut down the discussion of, trying to put a kid on those, was because I'd say, just explain to my parent brain apathy, because it's you don't get around it. It happens. That's what those drugs do.
Yeah, and they've got now these are statistics from 10 years ago maybe, but at that time they had over 80,000 children on ADHD drugs in the U.S. These are children, under the age of 5. They had over 38,000 on antidepressant drugs. They had over 85,000 on antipsychotic drugs. These are the drugs that rot out your brain and your peripheral nervous system. These people will put anybody on drugs. They had almost 400,000 on anti-anxiety drugs, which are addictive. Right?
Yeah. Well, really all of that stuff is highly addictive, because I'm sure you've seen people trying to come off of SSRIs and they're climbing the wall.
Yeah, especially Wellbutrin. So the first thing that people need to realize is the lies that these put out. And here's something from the Cleveland Clinic I printed out just a couple of weeks ago. It says, and this is about schizophrenia. So they go, oh, schizophrenia doesn't have a single confirmed cause. Experts suspect several roles. So this is what they're doing now. We suspect, us experts suspect a chemical imbalance in your brain. Okay, one of the first things they listed, the chemicals involved in it are those in your brain used to communicate between cells. So they're still pushing it. This is just weeks ago. This was printed out. Congenital brain problems. So here they are pushing the genetic stuff again.
Yep.
So they have to push it up where the average person can't debunk it. So they got away with this for years, making their billions of dollars selling this crap, until the biochemist showed up and went, hey, well, first there were the autopsies from the state hospitals, these people who'd been on these drugs for years. They started doing autopsies and found that their brains were shrunk like walnuts, totally atrophied. And they're going, well, we don't understand this, because other patients in the same hospital who weren't on these drugs didn't have this happen. So under the same circumstances, so they suggested that it was due to these antipsychotic drugs. And of course, Big Pharma and the psychiatric mafia are going, no, no, it's not our drugs. It's not our drugs. It's the schizophrenia. It's the schizophrenia doing that. So the researchers went back and started feeding these drugs to mice, rats, and monkeys. And they found this exact same results. And here these buzzards are feeding these to kids. What was it? 80,000 kids or something like that they had on schizophrenic drugs. Yeah. So
well, and back in the day, it used to be they wouldn't even consider those hardcore schizophrenic drugs unless you're at least 18. They wouldn't even dare consider putting a child on that. But
now they're putting children on it.
There was I want to say it was Risperdal. It was one of the new atypical antipsychotics that came out. And I was seeing, and because the new drugs come out, it seems like, everybody wants to prescribe them, for whatever,
Right.
Get them off the old drugs, put them on the new drugs, because, that makes sense. But, I was seeing this in a couple of my patients. I was like, I'll be damned if, a couple of my guys aren't getting breast. What are that? You know what I mean? The male breast. There's a term for it.
Mammalia something or other.
That's right. And so we would meet back with the group of our behavioral therapists at least once a month. So we get to chat it up. Hey, anybody else see anything weird with Risperdal? Like, yeah, all my patients are getting breast, and it's like we knew it. We knew that was going on without a doubt. And it was from the drug. We couldn't prove it exclusively, but we knew 99.9% sure. It took them probably another, I want to say 8 or 10 years before that ever surfaced that was a side effect going on.
Yeah, they don't want that kind of stuff out there. Matter of fact, all these new drugs are they just have less severe side effects. I mean, when I started off, it was Thorazine, Mellaril, and serotonin, or what was it? Not serotonin, but I forgot it.
The salt, lithium.
Well, they had lithium. They were still doing the shock treatments when I was at the state hospital. I mean, big time. I saw one and I almost fainted. That's how brutal it was.
I saw some of the damage from that. I had some patients that had, those partial lobotomies, and that just devastating.
Yeah, I met one of those guys, and I remember my impression. He's not quite human. So what these people are doing is they're just suppressing psychological symptoms or psychiatric symptoms. They're not curing anything. And they got the whole world convinced that they are the high priest of mental health and that they know what they're doing and that everybody else is full of crap.
Well, they wear white robes.
They wear white robes and they got big titles on their name and they're arrogant as the day is long.
Yeah.
So, when I got to the state hospital, here's all this stuff not making sense, and everybody's acting like, okay, this is just normal. And it's like, well, where's the baseline before where you're giving these drugs? Where do these diagnoses come from? It's they make them up. And they, I watched how they it's almost like they use a dartboard. I mean, okay, we're going to start with this drug, and if that doesn't work, we're going to try this one, and then if that doesn't work, we'll increase it. If that doesn't work, we'll decrease it. If that doesn't work, we'll try another drug, and then we'll decrease that until they find one that works the best. Okay. Now, one thing I found interesting was it was clear that whatever these voices were that the schizophrenics were hearing had an effect on their behavior. It's real clear. I didn't know how it happened, but they start listening to those voices and they would get in trouble. They would get in fights. They would quit their classes. They would attack people. They would just go off the deep end. They start listening to the voices. So I started asking all the staff there. I said, well, what are the voices and what are they saying? Oh, they're hallucinations. They're just hallucinations. Forget that. So I remember sitting in the psychiatrist's office once with one of my patients, and he was going through his, 15, 20-minute monthly check. And the patient was saying, he was being asked, well, how are the medicines working? He goes, well, I'm still hearing the voices. So the doctor goes, well, okay, I'll increase it. And that's the last thing the patient wanted. He didn't want to be more of a zombie.
Yeah.
And the doctor says, just ignore the voices. They're hallucinations. So I pulled him back a week later, pulled him in my office. I said, remember I was with you when the doctor told you to ignore your voices. I said, how's that going for you? He said, it's not. It doesn't work at all. Matter of fact, they got louder. And then I started asking others the same thing. What happens when you ignore the voices? Consistently, they got louder. They would not be ignored. I found that odd. Okay? Then the second thing I saw, just like you did, is that the voices were telling them consistently negative, abusive, insulting, derogatory stuff. It wasn't anything good. It was always bad.
Never about lollipops and rainbows and sunshine. It was always death and destruction, and you're awful, and you're nothing, and just nothing good.
Exactly right.
It would be considered verbal abuse if I would tell you these things.
And it was consistent. It wouldn't vary. There would never be any good stuff.
Yeah.
So my first question was, what keeps that on restricted? What keeps it on a negative path? Why doesn't it go random? Why aren't there lollipops? Why aren't there dragons or all this other stuff that you see with regular hallucinations?
Oh, it might be dragons, but they'd be attacking them.
Right. Yeah.
Yeah.
It was never anything good. It was never anything neutral. It was never anything positive, neutral. It was always negative. So my question was, what kept it on that negative path all the time? Why wasn't it random like all other hallucinations? Because I found that very odd.
Yeah.
So the second thing I noticed was these voices were anti-religious. They didn't want the patient going to church. They didn't want him reading the Bible. They didn't want him speaking to the preacher. In the psych rehab center I worked at, when the preacher held a ice cream social downstairs, none of the schizophrenics went. They stayed up on the dingy ward and read war magazines and murder mysteries, And I'd ask them, after I saw that a few times, it looked like a pattern. I'd start asking them, why aren't you down there with the preacher and eating ice cream and cake? Oh, I don't like preachers, and there is no God, and it's a waste of time, and I just don't like that kind of stuff. So one day I had one patient come into me and he goes, hey, when I repeat the 23rd Psalm, the voices react like worms thrown on a hot frying pan. I said, well, that's interesting. So what I did is I got the 23rd Psalm and I started handing it out to all my schizophrenic patients and saying, hey, read this every once in a while. Come back and tell me what the voices do. It was consistent. The voices hated the 23rd Psalm. They absolutely hated it. And I went, why would that happen? Why would a hallucination hate the 23rd Psalm?
Well, they're all having the same hallucination.
Yeah, they'd come up with some such bullcrap. So I started being intrigued by these voices because I strongly suspected they were driving this crazy behavior into schizophrenics. And nobody else in that entire hospital was the least bit curious about what these voices were telling these people. Nobody.
Jerry, I found it in my short stint that when I did have patients that I was just like, and we talked about one that I just was kind of like, no, this is just full-blown possession. This is not anywhere in the literature that I, went to school and read. Yeah, sorry. Anyway, go ahead, Jerry. No, go ahead.
No, so it kept going and going and going. So while I was, there's one schizophrenic I was questioning. Okay, and his voices didn't like it very much. I found out later. So they got him to go to the psychiatrist and tell the psychiatrist that I was asking him questions about his voices that he didn't like, and it upset him. Next morning, I ended up on the psychiatrist's office on the red carpet being told, you will not ask schizophrenics about their voices. They're hallucinations. When you're asking questions about them, you're reinforcing them and you're making them sicker.
Yeah, you're encouraging them, Jerry.
I'm encouraging them. I'm making them worse.
Yeah. I was told the same thing, and quietly on a few patients, I would kind of dive into what they were talking about, and that's why I started to see the things that you saw. That there's no way. They're always negative. There's nothing positive. It's the same theme.
Yep, over and over. So, yeah, and what was interesting is that psychiatrists at the state hospital were being beat up by schizophrenics at a rate higher or just as high as attendant staff that were spending 24 hours a day with them. So, back then it was in the 70s. They didn't have cell phones, so what we had was the grapevine. The grapevine was centered in the food factory, so this big cafeteria that prepared food for the entire hospital. It was a literal factory. And we'd all meet there, and then you talk about the other staff on other psych units and what was happening on those units. And it was like very frequently it would come across that this psychiatrist or that psychiatrist would get beat up by a schizophrenic. And that just boggled me, because I watched how much time they spent with these schizophrenics in the state hospital. 15 or 20 minutes a month at the most. And it completely perplexed me as to why are they getting beat up? What are they saying in 20 minutes that is setting these people off to the point where they're being assaulted at this horrendous rate? At the same rate as the attendant staff that are spending 24 hours a day with them. It made no sense to me. It took 7 years to figure that one out. And it happened my last year, the 7th year at the state hospital. There was one schizophrenic gal. She was on her meds. She was doing good. She was going to cosmetology class. She was doing good in that class, but she kept going off her meds. And she went off her meds twice. And the way they were looking at it back then, there's nothing else you could do for schizophrenia than take the meds. If they're not going to take the meds, they're not going to be able to function. So what they would do is, if they went off 3 times, they discharge them and put somebody else in their place, since there were limited class space, to see if they could get somebody in there who would stay on the meds. Okay? So when her mother found out that she was going to be discharged, her mother called me and she was just virtually begging me, "Don't discharge her. Please don't. I can't deal with her. Please keep her there. I'll come up there and we'll find out why she went off her meds." I felt bad for her. So I said, "Okay, all right, come on up this Friday and let's take a crack at it and see what happens." So she shows up. We bring the girl in and tell her, you're about to be discharged. You went off your meds 3 times. You knew what would happen. You were told before, if you went off your meds again, you would be discharged. Tell us why you did that. You know what happens when you go off your meds. She said, "You won't believe me." And I said, "Well, try me. I've heard some pretty weird stuff since I've been here. I don't think you're going to tell me anything that's going to shock me." She says, "The voices told me that the psychiatrist was poisoning me, and they pointed to the side effects of the medicine as proof that I was being poisoned."
They're right.
They're right. And she said, they told her to go off the meds. And then it clicked in my head. How many times did I hear patients saying that they were being poisoned by their psychiatrist?
You think there's a chance you might have actually been hearing something wasn't demonic, that was maybe, of a higher truth, maybe, or even angelic? Because I don't typically ever find the archons give you any bit of truth, or if they do, it's one. They rope people in with 1% of truth and 99% of what they say is a lie.
Well, yeah, but this isn't coming from them, and this was coming from her. Where she said the voices were telling me, and these other patients were they would just say that, they like I went off the meds because the psychiatrist is poisoning me.
Oh.
And you look at those symptoms. I think I have a list of them here. Okay, this is geodone. This is
that's an old one, isn't it?
That's an old one.
Yeah.
Okay, but listen to these side effects: skin rash, feeling of restlessness with inability to sit still, constipation, dizziness, drowsiness, excessive salivation, extrapyramidal disease. Okay, that's where it turns permanent after a while. That shaking, that quaking, that echinacea.
Yeah.
Movement disorder.
And that first one I think was tardive dyskinesia, right? That involuntary movement.
right? And the tongue
That
darting,
is,
they got that.
I've had patients say that is hell.
Yeah, and after a while, it becomes permanent. They can't
Yeah.
stop it. It's permanent neurological damage,
Yep.
generalized weakness, headache, nausea, weight gain, chest pain, fast heartbeat, low potassium level. Of course, you got the brain shrinking. You know, so they got more than 7.2 million kids on these drugs in the U.S. million. Over 85,000 of them on these antipsychotic drugs that actually destroy the person's brain. This is psychiatry at work. So I started asking these patients about their voices, and I had to be real careful at the state hospital because psychiatrists didn't want you to do anything to upset these people if you didn't have to, because they were getting beat up by them. So I think they were afraid of them. Okay? So I didn't have free gain to just question as much as I wanted. And I had to be very careful, had to lower the number of questions, had to monitor very closely if they were getting defensive or hostile or angry at the questions. So really put the skids on looking at things. However, when I got hired into the psych department at the state prison, if a psych patient were to go up to the warden and go, "Oh, the psychologist is asking me questions I don't like, and he's making me angry," warden would go, "Get out of my face! Go play in the traffic! Get out of here!" You know. So I had free reign to ask them as many questions as I wanted in the prison. So what I did is surrounded myself with a group of patients that were psychotic. They were on meds and hearing voices. And the agreement was I'd do everything I could to help them out to the best of my ability if they would tell me in real time what the voices were telling them while we were working together. Okay? So I had like a window into their minds as to what's going on in there, based on um, what I was seeing and what I was trying. So what I found is anything that the voices didn't like, I'd recommend the patient do more of it, because the prison was set up for abnormal violent behavior.
Yeah.
So if they went off, they were set to handle it. You know, uh, it got a little hairy every once in a while because some of these guys would come in and they'd go, they might go, "Oh, well, this guard disrespected me in front of these other prisoners, and I have to take him out. I got to do something with him. He really insulted me. I can't have that happening." So if that guy did go out and harm a guard and they found out I knew about it, I'd be fired instantly, if not put up on charges or something to that effect. So I had to be real careful with these guys. I would increase the number of times I saw those particular kind of people until I felt they were safe again. We probably headed off more assaults than anything else doing things that way. But I would constantly experiment with try this and see what happens. The 23rd Psalm was one of those things.
Mhm.
When the prison officials, the head of psychology, who found out I was handing out the 23rd Psalm, he ordered me to stop it. Didn't want anything to do with religion, you know. Um, so this list of characteristics kept building and building and building. This list of traits, and after a while, I started thinking, well, okay, what do I do if what would happen if I would throw monkey wrenches in these patterns? Okay? And patients started coming back and saying the voices don't like you. They don't like what you're doing. They don't want us to come here. They tell us you're full of crap and don't listen to anything you say, that you're a lunatic. You know, these are all these different ones coming back reporting the same things. So I'm looking for more patterns, and these voices fostered and created negative emotion. They would tell these people anything they could that would increase that amount of negative emotion that they were experiencing. They wanted the patient to increase anger, anxiety, paranoia, guilt, and shame. They wanted that as high a peak as they could get, because that's where that negative stuff came from. They're feeding them that negative stuff, wanting them to increase that negative emotional energy, and then all of a sudden that negative emotional energy would vanish. And I started seeing that pattern is like before the voices came, these people had a lot of energy, a fair amount of energy. After the voices attacked them and left, they had no energy. They were drained.
Yeah, psychic vampires.
Psychic vampires. So I started asking them questions about that. How much energy did you have before the voices came? 1 to 10 scale. How much energy do you have after the voices came? 1 to 10 scale. It was statistically significant. We ran it, I think, an analysis of variance on it. Something was happening there that after the voices left, these people were drained. And you'd ask them, you go, well, they didn't notice it unless you brought it up to them, because they were just feeling bad overall. It's like, oh, I feel a little better today, and then now I feel bad again. They're so used to feeling bad, they don't even question it. So I'd ask them, I said, okay, if you felt bad after the voices came and you didn't do anything to use any of that energy. They said, no, I didn't use any. I didn't do anything. I was tossing and turning all night in bed. I said, well, where'd that energy go? Their consistent answer was, I don't know. They didn't even think about it. It's almost like they were blocked from thinking about it. Something was blocking them. So then I would throw up like, if you stuck your hand in a fire 100 times and each time you got burned, what's burning you? Well, they had no trouble saying, well, the fire. I said, okay, if the voices came 10,000 times so far, and each time they come, you have no energy, where do you think your energy's going? Some of them would go, they take it, like that was a discovery to them. And others would persist. Well, I don't know, irrespective. And what I found when I was working in the ER, the last 10 years I was working for somebody else. I was working psych crisis in the different ERs around Tucson. And there, they didn't want you spending any time with these patients. They wanted them out. That's all they wanted. They wanted you to get them out of the ER. That was your job, And I didn't like that very much. I wanted to spend some time with them. What I found is the most important thing I could tell them if they could handle it and not turn me into psychiatry was that these voices were vampires, that these voices were parasites, that they were taking their energy. And you could point that out to them, and the voices would get furious. They would get furious when I pointed that out. And it wasn't like in the jail or the prison where these people were already medicated. These guys were coming in off the street. They were raw. They didn't have any medications. The voices were floored. They were raving. They did not like me giving them that. Huh?
Much clearer when they're not on so many drugs.
Oh yeah. Yeah. They did not like them having that information. They got pissed off. They started acting out, and the patients would even say they're getting louder. I don't know if I can take this anymore. And I always told them, I said, I don't have you locked in here. If you need to leave, you can leave. You won't get in any trouble. I won't write you up. Even the prisoners. I said, if you need to leave, go. I won't write you up. I won't get you in any trouble. Yeah. So here were all these patterns emerging. And the third one was they foster and create negative emotion. Then they energetically drain their victims. Now, if you look at these patterns, they're the exact same crap that's coming over the mainstream media right now. It's the same stuff. Negativity, anti-religious, create negative emotion, create fear, create paranoia. It's all the same stuff. It's like the mainstream media and the deep state are a macrocosm of the psychotic voices, and it goes on. They get louder after sunset, which is really strange. Between 3 and 4 in the morning, the voices get the loudest. They wake the person up. They don't want them to sleep. They want them weakened so they can increase their control over them. So if they don't have sleep, they do the same things in the concentration camps with prisoners, with army prisoners. They deprive them of sleep and torture them to weaken them so they can't resist. And the voices do the same thing. So again, they get much louder after they're ignored. They don't stand for being ignored. They foster destructive behavior. They foster isolation. And you'll watch these people out in the community. You talk to their parents. Well, what do they do all day? Well, they sit in their room all day, either listening to the radio or listening to their voices, and you can hear them carrying on conversations with their voices.
Yeah.
They want them isolated. Look what they did during COVID. Don't visit your family. Don't go for Thanksgiving. Stay 6 feet apart. They were pushing isolation as much as they could. They want to destroy marriages. They hate marriages. They hate babies. You know.
Well, over the Gnostic Christians, thousands of years ago, were talking about these archons and basically are saying everything that you're saying now too. They're anti everything that is basically of God. It's
Yes.
If you look in deeper, a lot of times the narrative is destroy humanity, destroy yourself. So what you found was really what we forgot about, but what we've known, or at least what our forefathers knew a long time ago.
Yeah. Yeah, and you look at the Bible, and 23 times Jesus has cast these evil spirits out of people, and they return normal. And what these go on and on and on. I mean, they demand the attention of their victims, so it's a constant battle for the victim's attention. They maneuver for increased control over the victims. They gaslight. They manipulate perception. The person might be walking down the sidewalk, and here's a bunch of people start laughing at a joke over on the other side of the street, and the voices say, "Oh, they're laughing at you.
They're talking about you." Yeah.
They're talking about you.
Yeah.
And one thing that's really interesting is they have control of they can bring up every rotten thing that patient ever did and rub it in their face over and over and over again to create that negative emotion.
Yeah, they seem to have an access to everything that's ever happened into your life. And so if there's any old, even traumatic event, they seem to be able to pick on those.
Yep.
If you've got any old bad habits, right, or old faults that you even think you've gotten over, well, they're sure going to dig at them and see if they can't pull them back up.
Yep. I've had patients who did something 20 years ago. They completely forgot about it until these voices brought it up.
And it's not to make you like have some revelation, oh, well, I can get past this now. It's always brought it back up to like lower you back down.
Right. To upset you, to lower your vibrational level. They have to keep you at a low vibrational level. And I've a lot of these patients that I was working with were just as curious about what these voices were and how they operated as I was. And they, at some point, they would have asked them, "Who are you?" or "What are you?" Well, what do you think the voices responded back? Take a guess.
I don't even want to.
We are you.
We are you.
We are you. So we're taught from the time we're kids that every thought that comes through your head belongs to you. That's far from true. Manuel Swedenborg, Christian mystic 300 years ago, said none of your thoughts are yours. They either come in from the light side or they come in from hell.
I love what Buddha said. Buddha said, "Be the rock in the stream." All right, yeah, you're just supposed to sit there. The rock doesn't move no matter what turbulence, no matter what crap goes over it. It just watches it all go by. So you can look at it that way as being your thoughts too. But yeah, 110%, brother, we are not our thoughts. Everybody, no, you're not your thoughts. You're a multidimensional child of God first. You're not just limited to whatever pops into your head. But most people don't know that. They think, and even society in many ways. I was just reading something today saying, celebrate your emotions, expand on your emotions. It's like, you don't even know those emotions are yours.
Yeah. Where do they come from? And, consider this. I mean, all of us have that voice ranting in our head all the time, telling you all this stuff you already know, telling you bad stuff about yourself and other people and what's going on. It's constant babble, blah, 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 blah. If that's you, then who's listening to it?
I love it. I love that. I've heard you say that a couple times. If that's you, who's listening? Yeah.
It's you that's listening to it. Those thoughts are not yours. So by these voices telling these patients, we are you, they want them to believe that those thoughts are the thoughts of the patient himself. Now, if he believes that, he will become the voices. He will do what they say. They will take him over. Psychiatry is completely clueless to any of this. Oh, we'll just drug the brain. Yeah, so they drug the brain. Those voices don't go away. They just lessen. They just gork the guy. He's like, well, yeah, I'm still hearing voices, but I don't care anymore because I'm all jumped up.
And
You know?
and again, there, what I was seeing was a lot of not only on some level it might have seemed to silence the voices. I don't really believe that much, but it lowered the person's energetic field when they were on these drugs. So what I was seeing was much like your friend Lynn Monet, where she can see a lot of this stuff. I'm not quite as gifted as her. I see it more energetically, but that's what I was seeing too. I was seeing that, no, like they put them on that hardcore drug, and then something else is jumping on top of them. It's like, heck, it that way. Once the oars open like that, I think a lot of times the demons are just like, hey, it's a free for all. He's wide open.
Yeah. I think the only reason they really work is so they calm the person down.
Well, I think
that,
I think a lot of times they work because on our end we just perceive right behaviors, right? Well, if
right.
it was aggressive behavior, well, if you were counting it, well, of course you're going to see less of it because they're doped up and they're asleep half the day. So
And that's what they want in these psych hospitals. They especially the state hospitals, they just want these guys under control.
yeah.
They weren't worried about curing them. They just wanted them under control. And when they found out that they could dish out medications and bring these entire populations under control, for them that was a godsend. That was a miracle, because before that they had to actually wrestle them into straitjackets.
Well, when I started at that 175 bed ICFMR, we still had a 5-way to a bed. We had ties to a chair. We had physical takedowns. It was ridiculous.
Yeah, I've seen it too, over and over.
We had a straight jacket too. I put myself in it once, but never actually used it on anybody.
I had one for a while. I think I gave it away to a psych professor or something. The other thing these voices do, they don't want the victim to tell anybody about them. Keep it to yourself. If you tell anybody, they're going to think you're crazy. They're going to lock you up. Your friends are going to leave you. They're going to take you to a psychiatrist. They're going to drug you silly. Unfortunately, that's what happens. The voices don't want to be found. They're consummate liars. They lie about everything. You can't trust them to keep any kind of deal that you make with them.
Nope.
And some of the worst I saw, there were 2 cases where they convinced the guy to gouge his eye out. They said, you gouge out one of your eyes, we'll go away and we won't ever come back. The guy did it. They were right back laughing at him like, okay, what'd you listen to us for, you fool? And they were laughing at him like, now you're maimed for life. You look like a monster. People are going to run away from you.
And there the demons or whatever, the archon's just creating more trauma.
Yeah.
I mean, and there you go. There's and like what we discussed before, this all started, when you in my practice here as a shaman, minister, and healer, right? I go back to the core of almost everything somebody brings in here, and it's trauma at the core.
Right. Yeah. Exactly right. That's where mace comes in. We'll talk about that later. The mace therapy, it's a new energetic therapy that completely gets rid of trauma without drugs, and it's permanent. So the voices consistently steer their victims away from anything that might generate joy or happiness. They don't want them feeling good. They don't want them watching comedy. They don't want them enjoying their lives. They want them miserable. They want them at that very low frequency, because that's the frequency in which they can withdraw the energy.
Oh, they can watch the spooky horror movies with the.
Oh yeah, they love that.
Yep.
Yeah. So they short circuit reason. They get the person to do stuff that doesn't make any sense. They try to pass themselves off as thoughts belonging to the victim. So all of a sudden they appear in your thought stream, and the intent is very different from your normal intent. And they hit everybody. They don't just hit schizophrenics. They hit everybody. Everybody's had, you're driving along in traffic and you go, oh, I wonder what would happen if I turned into the oncoming lane. Or you're standing on the edge of a bridge and you go, I wonder what would happen if I jumped. I even had a preacher tell me he was standing on the edge of the Grand Canyon and a voice told him to jump.
I've taught a class, and I teach a class. It's kind of a casting out 101. So I don't go into the advanced stuff, but people are really surprised when I tell them the true nature of these beings is you don't have to be crazy for them to attack you and to use you to attack your family. And, right. The case one of the examples I give is, was at a spiritual retreat, and we were dealing with a jinn or a genie. And so I could occasionally see it. And what it would do is it would kind of play on that person, I think, that wasn't being mindful, right? Wasn't really watching what they were thinking and that they weren't their thoughts. I would see the energy jump on their back. Then they would go verbally attack usually somebody else, right? Then if that person's guard was down and they got a little trauma, right? That genie would jump on that person and then use that person to go on and on. So almost like catching a bad virus. And, everybody's got those incidences of road rage where, you're just driving along and then somebody comes up and just honk, 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 almost runs you off the road. But if you're not paying attention, you turn around and start honking and start raging just like the person. It's the same thing.
Yeah. Yeah. It makes perfect sense. And you look at these people, these schizophrenics that go out and murder a bunch of people, and then they don't remember doing it.
Yeah.
They go, the voices told me to do it. The judge goes, well, we'll do it. Well, we'd lock you and the voices up together. Totally out of sync with what's actually going on.
Yeah, you're not really locking up those voices. If those voices want, they can leave that person and go into somebody else.
Yeah, and the prison, I tell you, the prison is full of them. That's the devil's workshop. Those prisons.
Yeah.
They close out all the mental hospitals. Throw these people out on the street. They can't function. They have to commit crimes to survive. Then they throw them in prison. They start using drugs out there. Throw them in prison. They're friggin' brutalized for decades. I mean, constant paranoia, constant assaults, threats, fear, paranoia, and after 10 years, they let them loose on the street. They're just cold-blooded.
Yeah.
Cold-blooded criminals. They're programmed that way, and they turn them loose just turn them out the door. I watched one guy, I knew he'd kill somebody in 6 months. Oh, his time was up. Give him $50. Turn him loose out in the front of the prison. On the other hand, if somebody escapes the prison, he murdered somebody, all of a sudden it hits the newspaper. Oh, murderer loose in the neighborhood. Everybody lock your doors. You're going to die. The papers are broadcasting it all over the place. They don't understand that they're releasing, tens of these people every day straight into the community with no resources, no backup, nowhere to go.
Well, and no understanding of how they drove those voices again to kill the first time.
Yeah. None. So I'm not going to go through every single one of these. There's like 23 of these, but you can go to my website at jerrymarzinsky.com under articles, and they're there. Anybody who's working with schizophrenics or has a schizophrenic son or daughter, this isn't like their biochemical imbalance thing where they have it buried in chemistry and all this bull crap. You can see these patterns for yourself. They're right there in front of your eyes, black and white. And if they're running patterns, they're not hallucinations. So this is a third major lie that the psychiatric mafia and big pharma are putting out to the entire world, that these voices that schizophrenics hear are hallucinations. If they're running patterns, they're not hallucinations.
No.
Okay. Now, I have here, I don't know if you want me to go into this, I have a poem by a psychotic killer that lets you know a little bit of what's going through his head.
Take a peek into his brain.
Okay, so what you'll be doing is peeking into the head of a psychotic killer here.
Yeah, let's take a peek.
I think he shot 3 people, and he cut his girlfriend up into little pieces, and they still haven't found her. Now I'm gonna have a hard time reading it because it kind of fades in and out. So he calls this the monster. Okay, so he's talking about this voice in his head who drove him to kill all these people. He said, there's a monster that lives in my head. This monster is real. It's not under my bed. My monster tells me things to do. It tells me sometimes when the news is new. My monster is crying as it spent all the years drowning out my courage and disposing disposing my fears. My monster is strong. That's what I like to think. My monster is coming when it's time to drink. So I guess he's talking about alcohol there. My monster is ready. My monster is strong. What will I do when my monster is gone? My monster will never leave. That is his plan. It overwhelms me when I'm making a stand. Okay. So I've heard a lot of these prisoners say to hear voices, said, I just turn the fight over to the voices. They're the ones that are doing the fighting, not me. And they beat the people to a pulp. I mean, so the actual person is no longer in control of the fight. The voices are in control of the fight. And that's what he's talking here. They overwhelm me when I make a stand. There's a monster inside of me. I thought I was strong. How could this be? My monster, he's a name too. He walks in the dark whispering Yazoo. My monster's watching me. He won't tell you his name. My monster is the shadows you cannot see. His heart is heavy. He plays for the game. My monster is aware. He wants to be monster. He's as blood from a lake. His bond is with me, new monster, now monster. He has something else to do. My monster's aware. Guy killed 4 people and then wrote that poem. And I also have some transcripts here of remember the people I was talking to you about that I was working with? You want me to read one of those?
Absolutely.
Okay, so this is an actual session where I'm exploring, what do these voices do? How do they work? What do they say? How do they react to different things? This guy that I'm working with here, he had an interesting story. He fully recovered, okay? And after he recovered, he told me this story. He said he had a giant arrest records. Page after page after page. He had a long criminal history, drugs, robbery, assaults, all that stuff. And he said one day he was using cocaine, and the voices came and they told him, "Hey, we know where there's a pot field in Oregon. Get your money, get 2 burlap bags, jump in your car, and we'll take you up there and show you where it is." So he trusted these voices enough to do that. He went and got 2 burlap bags. He had $250, and he was following where the voices told him to go, turn after turn after turn, all the way from San Diego up to Oregon, somewhere in the mountains of Oregon. And he drove there, went down this like 23-mile dirt road, and the dirt road ended. And he goes, "Okay, where now?" The voices said, "There's a hiking trail off to your left. Take it, walk up there a few hours, and you'll see it. Just follow the hiking trail." So he did, and he came to this giant Sesamilia pot field up on the mountain, and he had a machete. He cut down the pot plants. He filled up the 2 burlap sacks, threw them in the back of his trunk, and then he asked the voices, "Well, what now?" And they said, "Well, we know there's a park up where there's a park. You can sell this stuff." So he went there. He started selling the pot. He made a good bit of money. He bought all the prostitutes he could handle. He bought all the alcohol he could handle. He bought all the cocaine he could handle. And this is where it took a strange twist. I thought he might have been pulling my leg. He said the voices were fishermen. They wanted to go fishing. And I'm like, "Oh, come on now." And he goes, No, they want to go fishing." He said, "I went out to the Columbia River and I started fishing. They would tell me where to throw the hook, how long to keep it there, where to throw it next, how long to stay at that spot, and when to move on." He said he was the only one catching fish on the Columbia River that day.
I would guess he was, I mean, it sounds a little bit like a disenchanted spirit, but my guess with those abilities, he was probably working more with like a reptilian or a genie or something. Or
I don't know. I was taken back by his
whatever.
story. you know, and it was like, he goes, I swear, you know, that's how it happened. So he said after like 3 weeks of that, he was running out of money. He said, well, I need to go up and get some more pot. And the voices told him, no, don't do that. They're waiting for you. They know you've been stealing their pot. They know somebody has. They're waiting for you. You go up there again, they're going to kill you. You take your money and go back. So he did. He went back and went back to doing the same stuff again until he got thrown in prison again. Yeah. So that was a fairly interesting story. But he had completely recovered. So there are ways that you can get rid of these things. It's not just drugs. Okay? And you know, spirituality is one of those things. You know, they
Well,
like I said, they hate the 23rd Psalm. They hate the Bible.
you want to know a really simple practice, and I understand today how it works, and I'll still use it. But when I would have somebody as a behavioral therapist come to me and say, you know, I'm depression, whatever it was they were doing, even if it was something else, I'd say, you know what I want you to do for me? First thing you do in the morning, you're gonna have a notebook by your bed before you kiss your significant other, before your feet hit the floor, before you shit, shower, and shave. You're gonna just, without monitoring yourself, without editing it, write down every thought that's going through your head. And what I would see is they'd come back, and 9 times out of 10, especially if it was depression or anything else, it was always negative stuff right from the get-go, right? And so I would just say, no, okay, what I'm going to have you do now is flip the script. So every time something pops in your brain that is negative, you flip it around. Right. And amazingly enough, at the time I didn't understand they were probably really dealing with archons, right? Not just their own bad thought programs, but that enough, and a lot of times what I was seeing in my own patients was enough to, pull them from that pit and get them at least on top again to where they could, function and be normal.
Yeah. Or write down everything they're grateful for. First thing in the morning.
Yeah.
That breaks that pattern too. But yeah, it's constant putting negative thoughts in their head. So this session happened on 8/1/2002. And so what we're doing here is I would give him things to throw into those patterns to disrupt the patterns. And I'd bring him back and ask him, well, okay, what's happening now? So he comes back and he said, the voices have started coming back now once a day. He said, I can feel them in the wings. They start off by whispering, how are you? And I asked him, well, what do you do? He said, well, I completely ignore them and start praying. I don't talk to them at all. I totally ignore them. If you give them any recognition at all, they put their foot in the door and they start going. How long does it take for them to go away once you start praying and asking for help? He said, about 15 minutes. How about the fits they usually throw when you ignore them? Do they go ballistic on you? He said, no, I don't give them the time of day. I don't give them a chance to do that. Even before, I do these things before they can even throw their hissy fits. I said, do you have a whole lot of peace than before when you do these things? He goes, oh yes, much more. Do you miss the voices? He said, not anymore. He said, I used to. He said, they used to be more a part of me than I was. Are they the same voices you've been hearing for years? Do they change? He said, nope, they're the same ones. They don't change. I said, how many voices do you continue to come visit you now? He says, 2. I said, is that the same number as before or less? He said, it's 1 less. And I said, was the one who disappeared one of the weaker ones? He said, no. He said, it was a stronger one. And I was surprised. I said, really? He said, yeah. I said, what do you think happened to him? He said, I've been praying on a regular basis now. It seems that the strongest one couldn't stand the constant prayer. I said, have you forged a better link with the positive spirits? So he was hearing positive spirits too. He said, and that's unusual. He said, yes, the demons try to disguise themselves as good spirits. So that's one thing these people who are channeling, they channel these voices. They have no idea what they're channeling. These people who play with Ouija boards have no idea what's coming through. Those Ouija boards are very, very dangerous.
When I'm doing a house clearing, Jerry, whether it be remotely or if I'm at the house, the first question I ask in my investigation, where's the Ouija board? You know how often that comes up in a haunting?
I'll bet.
Yep. That, I mean, that is just the, you're anytime, or it's, anything to do with that black magic or that, that black art stuff. That's almost always what you find first.
Yeah, and I've seen patients where it starts off on the Ouija board, and then that voice moves inside their mind. Ouija boards are not toys. Do not mess with those things.
And then, that's if you're lucky and you don't get one that starts to throw stuff around your house.
Yeah, they've done that too. You know. So it surprised me that the strongest one left with the constant prayer. So that's got to be a part of it. I mean, everybody's got two guardian angels with them all the time. They're not allowed to interfere with your free will like these negative ones do. The negative ones come in there, they wreak havoc. They can do what they want. You have to ask the guardian angels to help you, for them to help you. Everybody's got two assigned to them. Okay. So I asked him, what do the good spirits do for him? He said, they help me pray when the bad spirits come. The prayers get louder inside and overcome the voices. I said, what kind of things do the good spirits tell you? He said, they tell me to be appreciative of what I have and I'll get more. They tell me to stay in prayer and to give thanks for what's around me. Okay? So prayer is a big part of this, because the voices are the dark side. You know, where was I going to go? I had an idea I was going to tell you about. I forgot what it was.
You come back.
Well, I got another one here if you want to hear it. I don't know.
Absolutely.
You want to hear it?
What, share, share your story about.
Oh, yeah. I got it.
Rubber band, the rubber band.
I remember what you said kicked me off. Okay.
Okay.
So here's these patterns that I was
Okay.
telling you about. Okay. Throwing monkey wrenches in those patterns. Okay? The voices are getting more and more upset. This small group of people that I had come in, that I was working with, schizophrenics, the prisoners, they're one by one, they were coming back saying the voices are getting really pissed off with you. They don't like what you're doing. They don't like us doing what you're telling us to, which was prayer and a lot of other things. Okay. Yeah. Some of which, the reversal negative thing like you were doing. So I was trying all these things and the voices were getting more and more upset. So that's coming in from all of them. And there were 10 or 13 of them. I mean, there's a lot of them that didn't want to do that because they didn't want to tell me what the voices were saying. So I just worked with the ones who did. Okay. And then the next thing happened. One guy who, after we finished the session, he turns around in the doorway, he looks at me and he goes, "You know what you're doing is dangerous, don't you?" And I just looked at him like, that's odd. Never thought about it. And he just turns around and walks away. And I'm like, well, that was interesting. And it didn't freak me out, but it was like a warning. And I kind of threw it in the back of my mind. I didn't forget it. I mean, I went, well, okay, noted. And it just kept working with this guy. And then a few weeks later, he shows up in the psych department. I don't know how he got in there without a pass, and he's knocking on my door. He was slowly getting better. The voices were coming less and less. They were coming further apart, and they were getting weaker. He knocks on my door, and he goes, "The voices want to talk to you." And that never happened before. It was always the patient would tell me what the voices were saying, and I'd speak through the patient. So the patient was like the interpreter. They'd say, well, the voices are telling me you're crazy and you're stupid and not to listen to anything you say because you're a nutcase. And I'd say, well, go tell them to stick their heads in the toilet or something like that. I mean, it was that kind of stuff. It was all went through the patient. But this time he comes in, he goes, they want to speak to you personally. And they want to speak to me personally? He goes, yeah, they want to speak to you personally. And I'm like, I'm a little freaked out about this because in 20 years prior, that had never happened. So I said, okay, come on in, and shut the door. And I said, well, what do they have to say? And these words came out of his mouth. You have no right to interfere with our way of life. And I was my head went boom. I didn't want to believe in demons, and I kept rationalizing it away, and my denial system was already in tatters. It was just hanging together with string and duct tape. I mean, it was in bad shape, and that collapsed it. It was at that point that I fully realized that these things were entities. They were not hallucinations. They were not some figment of the subconscious mind. They were not some kind of crazy something or other. They were coming from outside the patient, and they were running the patient. They were separate entities with a separate consciousness other than that of the patient, with a different intention than that of the patient. And that really shook me up. I mean, I just, boom, my head exploded. I didn't see anybody that day. I just closed the office and just sat there staring out the window.
Did the hair stand up?
No, not that time.
Not
Not that time. But it shook me up. It was like my whole world switched around. It's like, it's not what you're thinking. This is something very different, and I had no cognitive map. There was no, okay, what am I getting into here? And that was a pretty clear warning. You have no right to do what you're doing. And maybe in some cases I didn't. I mean, maybe in some cases they were supposed to have those voices, but I was helping anyone who appeared to want help.
Yeah.
To the best of my knowledge. So I didn't stop. And I don't know, it was a month or two later. I was reading a book called The Voice of Knowledge by Miguel Ruiz. He was a South American shaman. And it talked about these things being negative entities. Okay. And on top of that, I'd already been reading the Swedenborg stuff where he talked about them as evil spirits. And he described them exactly as I saw them, with all these traits. They were just, all of them were right there. There was a one-to-one match between what Swedenborg was talking about when he was talking about evil spirits 300 years ago and what I was actually seeing out of these patients. And then this medicine man comes up, and here he's talking about the same thing. So I brought this book into the prison, and I was always battering these guys with questions. What did the voices do when we did this? What are they saying now? How strong are they? How often do they? I mean, I was always hitting them with questions constantly. So what I wanted to do was this one guy whose voices were telling me, you have no right to interfere with our way of life. I wanted to read him this paragraph about what this shaman was saying about these voices being energetic parasites, because I'd already noticed the same thing. And I was going to ask him, well, what do you think about this? So I started reading that, and I look up at him, and he's got this crazy look on his face, and he looks like he's going to attack. He looked like a zombie. So I push my chair against the wall just in case he does, so I can kick him back. And then I turned my attention back to him and kept it there. And then behind my head was this loud electric crackling. It sounded just like an arc welder. It was just crackling right behind my head. And I'm like, what the blazes is that? And then it starts moving to the right and moving up the wall of my office at a 45-degree angle, making this crackling sound. I don't see anything. I don't smell anything. I don't feel anything, but I can hear it moving, just like somebody's rattling a bag or something. I mean, you can hear the crack, 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 crack. It sounds exactly like an arc welder. And I look at him, I said, do you hear that? And he just keeps staring at me with this crazy stare, that's just like he's totally out of it.
Like crazy eyes, Jerry?
Crazy eyes. And he's looking at me, and I'm like, this doesn't look good. So I didn't want to take my attention off him for too long, but I'm switching my attention back and forth between him and this crackling sound. It goes all the way up to the ceiling on the far end of my office, and then starts cutting across the top of the office over his head. So I could listen to this thing at the same time and watch him at the same time. So I could put more attention on the noise. I couldn't see anything. There was nothing there that I could see. And then it starts crackling down the left side of the office, and I'm watching him, and he's got this crazy eye stare, just like you said. And he's sitting there staring at me, and this noise jumps into this Rubbermaid trash can by my left leg. It starts crackling down there. Okay? Huh. I look in that can, and there's nothing in it. There's not even a piece of paper in it. The inmate porter had emptied it the night before. There's nothing in there. It's empty. And then just like it started, man, bang, it went out, dead. Just went silent. And he slowly gets up and he goes, I gotta leave. And he shuffles out of the office, and I'm like, get out here, go, get
And
lost,
take
go.
whatever you brought in here with
Yeah,
you.
yeah, with you, yeah. So I'm sitting there stunned. After he leaves, I start examining the walls to see if there's any burn marks because it sounded like a welder. I didn't see any physical indication that anything had ever been there. Not on the papers, not on anything, nothing. And I started wondering if I was going insane. It's like I started really questioning,
Well, the
am I
voices.
losing it? Where is
Well,
this going?
that's when the voices that come in your head and start affirming that for you.
Yeah. Yeah. So I'm like totally free. And there's nobody I could talk to about this.
Yeah.
I couldn't go to my boss or any of the other psychs and say, hey, man, this is just what happened. There's nobody I could talk to about it. I was like stuck with it. So I go out into the hall and I check the doors to the other medical offices, the doorways. Nobody's there. Nobody's in yet. I was the first one in. The doctors aren't in. The nurses aren't in. The only person in was the female guard at the other end of the building. Nobody's there. There was no explanation for what happened. None.
Knowing what you know now, right, and looking back on that, do you think you can break that down and just ponder what happened there?
Well, I'll tell you what happened there. I called him back probably, what was it, months? It was months. I think it was probably 2, 3 months later. I didn't want to see him. It's like, enough of him. I don't want to deal with him anymore. I had enough of that. Don't know where this is going.
Discernment told you his energy was just a bit off.
Yeah. I don't know if I want to deal with this again. That was too much. I mean, I was shocked. I went into shock. I actually went into shock, and it's like, where's this going? I have no cognitive map. I don't know what that was. I don't know what it could do. I don't know how dangerous this guy is. I don't know what I'm getting into. I have no idea. So I pull him in. I think it was 2, 3 months later. He comes in. He's looking good. I was expecting him to be a wreck, because you got something like that going on, and it's not a friendly force. I thought he'd be, no, he looked good. And I'm like, hey, I expected you to be a wreck. And he goes, well, why? I'm doing what you said. I'm not making any progress, but I'm holding them off. I'm not losing any ground, but I'm not gaining any. So I said, come on in, sit down. And I said, you remember the last time you were in here? Did you hear that crackling sound? And he goes, yeah, I heard it. But he said, I'm surprised you did. And I'm like, what in the hell was that? He says, that was them. I said, them who? The voices? He said, yeah, they were the voices. And I said, what were they doing? He said, they were trying to scare you off. And I told him, well, they did a hell of a good job of it.
Anybody listening out there, or new practicing shamans or people in the therapy field, don't go to fear.
Yeah, I was more shocked than anything. And you can't go to fear with working with these guys. You can't, because that's like running from a mad dog. They're going to bite you.
And it's like these beings really sniff that out.
Oh yeah, they know it. They know it.
And
they can feel it.
Yeah, I've dealt with a lot of, like, this one gentleman, he was 90 pounds, maybe wet, about 5'1", but I'd seen him throw 4 guys who were 6'3", just completely all over the room and just tear them up. But I'd go in there by myself and I'd say, no, I don't want you in here. I don't want you in here. I don't want anybody who anger or that negative energy coming in here. I'd go in there basically just kind of coming from that place of the heart, love, joy, and bliss, and talk to the guy. I'd come back out and I'm like, no, he's fine. He's ready to come to, dinner, whatever it was. How did you do that? I'm like, no, you're dealing.
Yeah, you cannot come from fear.
Yeah. I was throwing love at the situation rather than trying to. I wasn't going to wrestle with this guy. Heck, I saw the superpower he had when that entity would jump on him. He could whoop the heck out of 4 grown men that were 2 times the size of me. And he was only, if I said 90 pounds soaking wet, I think that was 10 extra pounds I added.
Yep. And you know what? I've seen the same thing over and over and over again. one case where they doused this prisoner with pepper spray. I mean, just doused him. He would not come out of his cell. They got the stun guns, 2 stun guns, 50,000 volts each. He's just standing there shivering. I saw those stun guns bring down the biggest prisoners with just one shot. He took 13, one after another, after another, after another. One was discharging while the other one was charging. You know, then they went and they got the dog. The prisoners are terrified of the attack dogs because they just rip you to pieces. They're like wild wolves. So he wouldn't come out of the cell. He's telling the guards, "You bunch of fairies, come in and get me. Yeah, come on and get me." Nobody was going to go in that cell. Yeah. So they went and got the dog. They cracked the cell. They told him, "You come out of there, we're going to sick the dog on you." So he's sitting on his bed. He goes, "Sick your dog on me." So the dog runs in there with a long rope. He throws his hand up in front of his face. The dog bites him on the wrist, right down to the bone. He's gushing blood. He pulls the dog up to his face. He looks it right in the eye and he says, "Sit." And the dog sits, but doesn't let go of his arm. So then he starts petting the dog and going, "Good puppy, good puppy." And all these guys are outside the cell. You know, there were probably about 30 guards out there at that time. It was like a 3 tiers, and all these prisoners are watching this go on. So the guards couldn't lose. You know, they had to somehow win this. And they pulled the rope and drug him out of the cell and then beat the crap out of him. But what he did was superhuman.
Yeah.
I mean, that much pepper spray would have brought anybody down. One shock from any one of those stun guns would have brought any normal man down. You know, and then the dog, you know, to pull the dog to your face and pet the dog. I mean, bizarre. You know, so they become supernaturally strong.
Yeah.
Something gives them extra energy. They
Yeah.
get it from somewhere because it's not human energy that they get. I've seen it over and over again, just like you said.
Yeah.
You know, you don't these new guards that think they're hotty totty and they're going to muscle around a schizophrenic patient. They only do that once.
Yeah.
So yeah, that's what I had there. But
No, do you think that was because I had on my list to ask you what was the strangest, oddest thing that you've seen in the practice, you know, would that be it?
Well, I didn't finish it. I forgot about the end. So I called this guy back in and he said, "Yeah, I heard the noise. I was surprised you did." And I said, I told him, you looked really weird when you left my office." I said, "What were the voices telling you when you left my office?" He said, "They were telling me to go get a shank and stick it in your gut." Shank was a homemade prison knife, you know.
Yeah.
And I went, "Well, he wouldn't do that. Now I've been working with him for 6 months. He was doing good. He's still holding his own. He wouldn't do something like that." And I asked him, well, why didn't you do it?" He said, "I couldn't find one and nobody would give me one."
Yeah, no, I believe he would have. I mean, what you were seeing, that stare, right? Sometimes it looks blank, sometimes it looks a little bit different, but you see the eyes sort of change.
Yes.
Now, that to me, that's that sign that knows something else is taking over.
Something else is taking over there.
Yeah.
Right.
I had a couple patients, and I would know which days to interact with them and which days to not, because I had one patient, I was either Jesus Christ and he loved me to death, or when I would see those, or when I'd see that change in his eyes, I knew I was the devil, I was the son of a bitch, and he was going to be aggressive.
Yeah.
But I could always tell by that look in his eyes.
Yeah, so I got to wrap this up soon because I got somewhere else I got to go. But I wanted to mention something about, you know, the mace energy method.
Yeah, so I'd like you to dig into that just a little bit while you've got a minute.
Yeah, a little bit. But so the psychiatric mafia and big pharma, you know, psychology, they've got the entire planet believing that the only way to treat mental illness is with drugs. And these drugs are toxic. They don't cure anything. You know, even the psychiatrists will tell you they don't cure anything. You know, if schizophrenics, you take the meds, they calm you down. You go off those meds, the voices come right back. You know, I've seldom, if ever, seen them do a permanent cure. Sometimes they will stop the voices for a period of time. Very seldom. But if they do, once you go off those meds, the voices come back and it comes back again. So what causes most psychological problems is trauma.
Yep.
Okay. So during a trauma, all your attention is focused on you. Okay? and you're overwhelmed with a negative feeling, and that feeling is non-survival. It doesn't feel good. And during that trauma, you make some decisions, and they're not good decisions. Your attention is totally focused on you. You're feeling bad. You don't make good decisions during a trauma, and you will make a decision something like, well, based on this incident, I must be worthless, or it must be stupid, or it's 99% of the time it's a negative conclusion about yourself.
Yep.
Okay? And then it's reinforced by this overwhelming feeling. Okay? So you have the thoughts and the feelings conglomerated together, and they feel awful, and they're not survival. So they don't help you survive. So they feel bad. So the ego jumps in and goes, "Oh, let me handle this," and it takes it and it buries it in the subconscious mind, but it buries it alive. It's still alive there. So it still affects your thinking, your feelings, your behavior, your decisions. It's still there. So you come up with this due to that trauma. You come up with this idea that you're worthless, and that's running in the background the entire time. It's like a computer virus. You're worthless. You can't do anything good. You're stupid. It's all running in the background, interfering with your life, and you're progressing. And it's frozen back there. You're not even aware of it. It's like a computer virus running in behind the background of the computer. So what MACE does, it's an energetic therapy. They call it a non-talk therapy because it involves very little talk. The therapist does not have to know what the trauma was. He doesn't have to know. It works anyway. It works in the energy universe. So there's no time, there's no space, there's no matter there. The rules there are very different. How it operates is very different. But in a matter of an hour or so, Mace can go in there, turn that negative. So Mace found that the mind works very differently than what the psychiatric mafia and psychology does. He said that the mind works only by taking pictures of where you put your attention. And he found when you turn a trauma into a picture, then there's a way to get rid of it, to drain it. The person's being a positive force, when directed to that trauma, will drain it. So it works like draining a car battery. So you can get a brand new car battery, you can charge it up as much as it'll take. You drain it down to absolutely nothing, you can't bring it back up again. It's dead. Right? So the trauma is a negative charge. Okay? Negative is absorbed by positive. Okay? So you put that positive spiritual charge on that negative identity, and it will drain it of all its energy, just like a car battery. The person will still remember the trauma, but they will no longer have any kind of emotional impact. It'll be, oh yeah, I remember that. So yeah, it happened. That quick, and it's permanent. Doesn't go away. It doesn't come back. So if you're out there and you're feeling depressed, and you're thinking about going and taking antidepressants, try causism first. It's a whole lot cheaper, it's a whole lot faster, and the results are permanent. And it doesn't have any, toxic effects on your body like antidepressants and antipsychotics. So you can find out more about this system by going to causism, www.causisminstitute.com. So that's CAUSISM Institute, INSTITUTE.com, all one line. And there'll be a write-up on it. There will be MACE therapists there who you can engage. There's 2 books written on it by John Mace. It's called Causism, and he calls it causism because it gets to the cause of psychological problems. It's not like talk therapies where you just talk about the trauma over and over and over again, and it gets worse and worse and worse as you keep wallowing in it. It actually gets rid of it. Okay? So he's got the book he wrote, Causism, and then he wrote Energy Over Mind. So
Wait,
this isn't.
wait a minute, Jerry. You tell me I don't have to understand all my weird emotional stuff tied with my mom to be able to get past all that stuff?
You're going to have to feel it.
Oh,
You
okay.
will have to go back and visit that worst moment of it and be there for a while. Okay, while the therapist arranges for the spirit to attach to that negative identity and drain it.
Gotcha. Okay. Is it on an overview, right? So do are you dropping keywords to see like what hits,
No,
right?
nope.
So how do we, right? So how to give me like a quick example of how I would uncover something from my mother or something
Well,
really helpful.
what happens is the spirit finds it. So one of the biggest problems that John Mace had is where did the ego bury this crap?
Mhm.
Okay, it could be anywhere.
Yeah.
You know, so what happens is you work with images because the mind works with images. You know,
Okay.
if I say think of an apple, what do you see?
Well, when you just said that, right? I
Or
thought
don't
of the
think of.
apple. I thought of the apple, but then right behind that, right after that, came a little black worm on top of that apple.
Okay, so I say if I said don't think of an elephant with two tusks, what do you see?
I was thinking with two tusks.
Right. So the the spirit will find where it's buried. Okay, through the imagery. You know, so you'll tell them, well, take take these traits and turn them into an image. The mind will the 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 mind will then find it, okay? And then you work with that image.
Gotcha.
That image is the battery. It represents the battery.
You know, I know there's no one is exactly the same, but if someone would come to you right now, do you work over the phone or is it all in person?
Well, no, it's I work over Zoom,
Okay, so
so
perfect. So
I need to be able to see the person,
okay, so there is.
but I don't know that I don't need to know anything about the trauma. They don't
Yeah,
have to tell me anything about it,
yeah.
except
Well,
maybe where it happened and what do they see around them when they did. So
I
they
mean,
don't if they're sexually molested, they don't have to go into all that crap.
I get what you're saying. You're working more on the etheric, and you're allowing that positive spirit to basically kind of do a lot of that work.
It
To
does it
as
all.
you,
It's
yeah.
the person's being that does the work. I don't
Yeah.
do the work. I'm
What
more
what if
the
what if somebody let's say is Buddhist or somebody's Christian or there's somebody's
doesn't
Hindu?
doesn't
How,
matter. It has nothing to do with religion. It works anyway. They could be Hindu, they could be Japanese. The mind works the same way in
sure,
all human beings.
sure.
And the psychiatry, psychology, social work, they know nothing about the mind. They they don't want to deal there because they can't measure anything. They can't see it. They can't feel it. They don't know what it is. It's energetic. There is no time space. There is no matter in the energetic universe. They the rules there are very different than in the physical universe. So the person works with his eyes closed because we want him to be in the energetic universe. So it's kind of what psychiatry is doing. It's like you get a friggin' magnet. You get this big magnet with this huge magnetic field. You can't see that magnetic field. You can't smell it. You can't taste it. For all practical purposes, as a human being, you can't sense it. It doesn't exist.
Yep.
You know, you get a jar of iron filings. You put it on that magnetic field. Now you have an outline of the magnetic field. Okay, so what psychiatry does instead of discharging that magnetic field, it pours chemicals on them and thinks that it's going to go away. So they muck up that magnetic field with pouring all these drugs on them. It doesn't get rid of that magnetic field. And
I've
it's the
seen.
same thing with all these facets, all these traits. You know, those are the magnetic field for the voices. That's what the voices operationally look like. All those traits that I was listing to you.
Yeah.
That's what they are. That's their behavioral manifestation.
Yeah.
And psychiatry is completely out the window on that stuff. They have no idea that these things even run patterns because to them they're hallucinations. That's what they were taught in college. That's what was hammered in their head all the way through psychiatry or psychology. They come out of there believing that, and anybody who's investigating hallucinations must be a wacko, you know. And they don't make any sense to them, really. So they look like they're hallucinations, but they're not.
How many sessions typically? I mean, I know everyone's different, and some people miraculously, can get better very, very quickly. But on the average, how many times before, someone can say, like, right, Jerry, that's good. I don't need to see you for.
Well, it depends on how fast they're able to process the information. With some people, we're able to get rid of what they call the rune, which is the biggest destructive idea about themselves that they've incorporated through a major trauma in the first session, usually. And sometimes we can get rid of some relationship issues. But I'd say by the end of 2 or 3 sessions, they're pretty clear.
Yeah.
Now you can keep going if you want to pick up these other traumas that you pick up in life, but the major stuff will be clear in 2 or 3 sessions.
Okay.
It's very quick, very effective, very efficient.
A lot of
it's almost like magic.
Yeah, a lot of my circle over here. I mean, we work in energetic healing, so what you're talking about's not outside of the scope of a lot of my audience. They're going to want to ask you more questions about it. Now, do you also teach the modality?
No, I can't do that. I had to sign a contract when I took their course. So they have a certification that you have to go through. They want to make sure that the people they turn out know what they're doing.
Sure. So, but you haven't got that certification yet to teach.
Oh, I got it.
Oh, you did?
I've had it. Yeah. Now, what you can do is get those 2 books I told you about. There's enough information in there to basically put the system to work. You being a therapist, you're not going to have any trouble piecing together the basic system and how it works.
Well, and I mentioned earlier, I've not had a session myself, so I can't 100% verify this, but it sounds a lot like what I was actually drawn to do instinctually in psych outside of what I was taught. And then there's also, I'm not promoting this therapy, but theta healing, I've taken a couple different courses in that, and they have sort of a book that it sounds pretty similar. So if it's anything like what I've experienced before, I know the stuff works, and I've used it in my own practice, not the mace, the obviously technique and the way it's prescribed, but no, I'm glad that you found that this has brought some help to people and can actually be something that can move people forward, because obviously in the field that we were in, there's really nothing there that can help. And I know if you're like me, I mean, I got into psych not to be the, hey, I'm the doctor wearing the white coat type thing. I got in to help people. And
right.
So, and once I realized in that field that my hands were tied, even though I was called to God to work in there, and there's no way that I could have possibly won the lottery to be so fortunate. But, at a certain point, I had to say, I'm done with this. And
I ran into the same thing. This is useless. This stuff they taught us all through college and graduate school is useless. And it was even worse than the free PhD program. They don't know what they're doing. This is the only thing that I've seen ever work. Now, with the behavioral therapies, they were starting to move closer, but they weren't. They were still a long way away.
Well, behavioral therapy is nice, but it's not the end-all, be-all to mental illness, in my humble opinion. It's a nice tool to have in your toolbox if you're a therapist, but it's not. It does not solve everything that I've run into.
No, and then when you consider that most psychological problems are based on some kind of trauma, and the mace is designed to drain that trauma and get rid of it.
Yeah.
I mean, I think this is the psychotherapy of the future. I mean, I've never seen anything work like this. I've been surprised time after time after time. Working with alcoholics, I mean, it was like spinning your wheels. It was nothing you could say to them would help a whole lot, because these negative spirits would jump in there and they'd be, no, I saw with my own eyes. I mean, I didn't believe it, but I saw a female alcoholic just stopped drinking and went back to drinking normally after a mace session or 2. She wrote me back a couple of months later. I have a drink every once in a while, once every 2 weeks, and I'm drinking normally again. But where before she had lost control of the alcohol. I didn't believe it myself. Lots of psychosomatic stuff. That physical problems that are caused by trauma stuck in the body. I've watched them just vanish. People who've had aches and pains in their backs and shoulders and, for years, it just vanished, and they're just amazed. Like, where did it go? Where did it go?
Yeah, because it's not really real to begin with. Half the times it's one of the archons whispering something in their ear, and once they let the archon go, the disease disappears.
Well, that's the other thing. The archons feed off of this negative emotional energy that's stuck in your body. You get rid of that, their food source is cut drastically.
Well, I found it interesting in my own practice, right? Christ said, go cast out and heal. Now, why didn't he say heal and then cast out? It's my humble opinion, and I've heard other pastors and preachers, Derek Prince, you can still find him. There's two Derek Princes on YouTube. One's an Asian pastor. It's not him. One's an old British pastor, and he's done past. But what I loved is he talked about the meat and potatoes of the spiritual warfare. And one of the things he said to me that I found to be very, very true, and I'll use in my own practice and I use in my own life, how do you know the depression? How do you know the pain? How do you know the anger? Whatever it is yours. First take it to Jesus. If Jesus says it's not yours, tell him to get rid of it for you. And time again, I've seen in my own life that, yep, a little pain here and there is not really a pain. It's something else. The first healing session, well, not the first, but one of the first I did with the vision drum that I had that I was guided to put on a woman's lap. Now, the eyes thing, right? As soon I asked her if I could play this drum in her lap, and she agreed. And it was the first time I had done it. But when when I was looking at her eyes, Jerry, and I did a clearing prayer, just a simple prayer in Jesus' name before we started, her eyes were really, really cloudy. Now I asked her to close her eyes, and I started to play the drum in her lap, right? And everything I do is in Christ's name. But it was a minute I was playing this drum in her lap. She opened her eyes, and number one, they were clear. Whatever that fogginess was gone. All of a sudden, she stood up and she said, Jesus Christ, Jesus Christ. And she said, no, Devin, I don't mean any offense. And I said, dear, you did not offend me. And I said, I really don't think you offended Jesus. Now, I knew I felt the presence of Jesus in that session. So I said, what happened? She said, no, Devin, I've had 20 years of chronic back pain. I've had it operated on. She said, it's gone.
Yeah.
It was never hers to begin with.
Yeah, people collect negative energy in different places in their body. It's as far as I'm concerned, this therapy is revolutionary. This guy Mace, he's the modern Sigmund Freud. And I like I said, I've been on the front lines my entire life. I mean, close to 50 years. Working all different kinds of things, going to all this in-service training to keep your license up, going to all this other training and training, and none of it did a damn bit of good.
Yeah,
it did not work. This works.
Hey, you know what it did work to do? It worked to show you how crooked and awkward the current system is and how ass backwards it is, and then motivated you to help you, to get you to find something that we can help people with.
Right. And to expose the lies of this other system.
Truth sets us free, brother, right?
Truth sets us free, and I think everybody got a good dose of the truth today.
Amen.
But once they're clear, they need to get on a positive spiritual path and stay there.
Yeah.
I mean, that's the end, and they can't just drop back, because if they go, well, now I'm cured and I don't have to keep moving forward spiritually, then they're going to stall out. It's like an airplane losing speed; it falls out of the air. And like the Bible said, I've watched this time after time after time. Yeah, you clear out the house, but if you don't replace it with good stuff,
and that's a simple behavioral therapy technique too. Just I can extinguish your behavior, but if I don't put something good in its place, well, it's going to fill with whatever.
Yeah, and I think people ought to find it strange that these negative voices don't like the Bible. They don't like preachers. They don't like the 23rd Psalm. I mean, why would that happen? And it happens consistently. Just read the 23rd Psalm to any schizophrenic and say, "Oh, what do you think of that?" You'll get a bunch. And one thing, they have their schemes too, because some people go, "Well, yeah, the answer is in the Bible, and I'm going to stick with it. I haven't found it yet, but I'm going to just keep reading it until it does." So the voices come back and go, okay, if you're going to read the Bible, you need to read it from cover to cover. Right? And the patient goes, okay, I'll read it from cover to cover. Then they hit that place where this guy begat that guy, begat that guy, begat that guy. It goes on for 30 pages of who begot who for hundreds of years. And the voices show up again. They go, well, what are you reading that crap for? Look at that's bull crap. I told you it was bull crap. Why are you spending your time there? Jesus couldn't even help himself. What makes him think he's gonna help you? You know how many times I've heard that over and over and over? So it's almost like they're all educated in the same school, or they come from the same great cookie cutter in the sky, because they keep running these same patterns over and over and over again. It's predictable. You know, if it was a hallucination, you wouldn't be able to predict it. These patterns are completely predictable. You watch for them, you will see them.
Once you can call out those patterns and you can see the patterns, you can end it.
Well, you know that it's not a hallucination.
Yeah.
You know that it's something else doing it.
Yeah. The other thing I hope everybody remembers, you don't have to be schizophrenic to be attacked by these archons.
Oh, no. Nope, they get everybody. Matter of fact, Sherry Sweeney, who she wrote if you want to know more about the voices, pick this thing up. You can get it on my website at jerrymarzinsky.com. Or you can order it on Amazon. But it's an amazing journey into the psychotic mind. So it goes into how we discovered that these voices are not hallucinations. That they are something very different, step by step. And it also exposes psychiatry for all their bullcrap.
Good deal, brother. I'm glad you did it. I'm glad you did it, so I didn't have to.
Okay. Well, I'm out of time here. I got to start moving on. I got someplace I got to be at in a little bit.
All right, Jerry. Hey, man, I really appreciate you coming on again. I know my audience does too. Everybody go check out more of Jerry's work. Go check out his website. And if you need a session, I think it takes a while to get in to see you, though, doesn't it?
Yeah, it takes a couple of months. Easy.
That's a good sign, though.
Okay, send me a link when you have one.
Yeah, namaste.
Okay, thanks for having me.
Brother. I'll talk to you soon.
All right, bye-bye.